Welcome to this edition of CEO Corner. I'm Otis Rawl, President and CEO of the South Carolina Chamber of Commerce, and I'm happy to have with us today Thornton Kirby, who holds a similar position at the South Carolina Hospital Association of President and CEO. Thornton, thanks for being here today.
Oh, it's a pleasure. As a member and as a partner, it's always great to be at the Chamber.
Well, I tell you what, it's a tough day and a happy day and a busy day to be in healthcare right now. I know whether you are a provider or whether you're an insurance company or you're like us business folks trying to figure out what's going on at the national and state level, and maybe we can talk through some issues today and help our folks understand exactly what's going on out there.
You're exactly right. It is a really volatile time. It's a time of a lot of opportunity. It is a crossroads when our nation has to rethink how we deliver health care and what we expect of the healthcare system, and we've got to bring our costs under control for business, for our national security, for all these reasons. You know, I was at the American Hospital Association's annual meeting this past week, heard from a lot of elected officials and commentators, and one thing remains true. You know, Americans really want three things from their healthcare system. They want the best care in the world, they want somebody else to pay for it, and they don't want to change their behavior. And that's what we've got to struggle with. But I'm delighted to be here. I look forward to talking about all these issues.
Well, I think that's one of the issues that we've talked about. It started maybe last year at our annual meeting when Joe Sally started talking about what is the second highest cost usually for businesses other than payroll, and that's health care.
Right. And
providing that fringe. And when you look at health care cost in the United States in comparison to other OECD countries, we're almost 2.5 times the cost there. And I read the question, Thornton, was how do we get there, and what do we have to do to start beginning talking about cost controls within the system? What can businesses do to help? And you know, I think everybody sees hospitals as a place that, you know, they pay bills, but hospitals are also businesses too that incur the same type of cost that every other business incurs when you start talking about healthcare. So it's a double-edged sword for you.
Absolutely, because we have that benefit cost that's a very high component of our overall business structure as well. How did we get here? That's a really great question. I think it has to do with our culture and our expectations. We are an instant gratification society. We expect to have the very best. And we don't want to have to wait for it. So one of the great concerns we have about other nations is the fact that they are not as quick to give everything to a patient because of the way their insurance is set up. But when we make utilization so easy, it drives up our costs. And we also tend to be less healthy than other nations. So we've got to get at several aspects of this, and there's a lot of work right now around what's being called the triple aim for healthcare. There's been a great movement in this country in the last decade to improve quality and safety of patient care, and we've seen some great examples of that. But going forward, we have to work on three different things simultaneously. One is quality of the patient's experience. Did they have a good experience, and did they have the right outcome? Secondly is how have we dealt with population health? Are we getting healthier as a society? And then third is, can we reduce the per capita cost of care? We have to make healthcare costs less per person. For an example, let's say hospitals and doctors can figure out how to cut down the cost of an open heart surgery in half. If we do 2 times as many, we're not going to save any money. Right. So we've got to reduce the population's need for health care, and we've got to reduce the cost each time we encounter it. And that's what our job is, and we understand. I'm really excited because our hospitals and physicians in this state get it. They know they have to get higher quality at less cost in the future, and that's where they're working right now.
Well, what's ironic, and I know y'all are really put in an untenable position under EMTLA, which requires hospitals to deliver health care to everyone, whether they're insured or not insured.
Right.
And how y'all absorb those costs is really not something that any business would want to do, just knowing that you've got to deliver service without being able to recoup a lot of it. And you know, we see that on our side of it, particularly from the standpoint of we know that some of that cost shifts occur. And what must business do to help y'all? I know things like health screening helps, trying to encourage our employees to get into exercise routines. What else should businesses be encouraged?
That's a great question. There's several ways that we have to work together. We have to reduce the cost of what we deliver. But business and individuals need to help us keep the population healthier. Because when patients do come to the healthcare system, the costs are going to be incurred. We need to reduce that, more preventive care, better health and fitness, as you say. There's another interesting thing that business is helping us do, and that is teaching us how to improve our business practices, lean production models, Six Sigma reliability kinds of issues. In fact, we just had a great visit about 3 weeks ago to the Riverbank Zoo with some of our people to learn how they manage animal health, which is in many ways different and in many ways similar to human health. So learning from business is a great thing that we need to do. For a long time, I think the healthcare system was arrogant and thought, you know, treating people is not like making cars. We've gotten past that. We recognize there are a lot of things in manufacturing that we need to learn about reliability, consistency, variation.
Well, I think one of the issues that I know that drives healthcare costs way up is we don't get people into primary care early enough. And usually when they end up in your emergency room, it's a last resort for them. Are there things that the hospitals are contemplating as we work with other primary care providers to ensure that we're getting health care to the individual at an earlier stage so that they don't end up at the most expensive care within our system?
Absolutely. And regardless of what people think about the healthcare reform law that was passed and whether it stays in effect or not, one of the key messages there was we're not going to be paying you anymore for volume. You've got to get the right outcome at the cheapest cost. And that means we've got to get into people's lives and help them manage their health, keep them out of the emergency room, keep them out of the hospital. That's how we're all better off. It's better for them, better for us, and better for those who pay the bills.
Well, what's interesting too is I know that there are a lot of hospitals that are taking the training and producing primary care providers. You know, they've taken that as part of their own. I know Greenville Hospital System, Spartanburg Hospitals are saying we go grow our own, our own doctors, and so that we can have doctors in the communities that kind of help that. You want to talk a little bit about what those hospitals are doing to try to address?
Well, they are trying to increase the number of physicians we produce. I came to this job out of higher ed, and one of the challenges in the state in higher ed is a debate over how many of any particular major or degree we should produce because it costs the state money. That's not the conversation that I think you and I need to have right now. It is, do we supply enough health professionals for our needs? And that's the conversation that these universities and medical programs are having. We need enough primary care doctors. Now, here's one of the problems, Otis. Our system doesn't pay primary care physicians as well as it pays specialists. We pay in our country for doctors to do things, procedures. Well, a primary care doctor who sits down and coaches you doesn't make nearly as much money as one who does a procedure on you. That is a fundamental flaw in our system, and it's got to be addressed.
Something's got to be addressed.
And that's why people don't want to go into primary care medicine. When you could be a dermatologist, you never take call, and you set your own hours, and you do much better. And we need dermatologists, but we do want bright young physicians to go into primary care as well.
Well, I know at least from the business standpoint, we're fighting tort reform and trying to protect at least our businesses from frivolous lawsuits. I know that the medical profession faces that issue every day, and a lot of what the medical profession does is preventive medicine to prevent health care litigation, things of that sort. How big a deal is that for the hospitals in their everyday operation?
I think if we're talking about taking unnecessary costs out of healthcare, this is an important issue we've got to talk about. The classic tort reform model has been to address the damages side of liability. If you're liable for malpractice, we're going to limit how much the payout is. I think the opportunity for us to save money here in healthcare is on the other side. That is, whether there's liability at all. We know so much more now from watching national data about what constitutes the right care for a heart attack or the right care for a stroke. And the federal government is publishing that and saying we're only going to pay you if you conform to the right evidence-based standards. And that's what we as patients want. Well, if the government can be that confident and we can all agree that is the right care, why then can you be sued if you provide it that way? Why shouldn't we protect people who follow that?
Those guidelines.
And then you get some comfort on the behalf of physicians who are not so inclined to over-order tests that rule out things they really don't think are there.
Well, it's not an easy task,
no, it's
not an easy issue. And I know that we're going to see a lot of debate, not only at the state level, but at the federal level over the next 2 years. And it's more than likely going to be the issue, if not one of the top 3 issues that's going to create the debate in the next election cycle. So, Thornton, thank you for being with us this week. And we appreciate the article that Thornton is writing for us for our May-June magazine that will be focusing on healthcare options and what businesses and what the providers and what the insurance industry is doing to try to control costs for healthcare for our businesses and also make sure that our employees are covered. So, Thornton, thanks again, and we look forward to the continued partnership between the South Carolina business community, South Carolina Hospital Association.
It's a pleasure, Otis, and we know we have to help business keep costs down. We need business to help us learn how to do that better, so we look forward to the partnership.
Thank you.
Thanks very much.
Thank you for joining us on CEO Corner. We'll have another edition here very soon on issues that are real pertinent to the business community.